Thank you very much. Yes, I'm here to present the Scandinavian multicenter randomized trial, and it's more describing the study and just an interim analysis of liver growth rate after 7 days. This is a joint study between Sweden, Denmark, and Norway and the major liver centers. As you all know, in patients with multiple colorectal liver metastases, two-stage liver resection with portal venous embolization or ligation is the standard today. The problem with that technique is that liver sometimes grow too slowly and have a too slow kinetic growth rate, as you can see, is estimated to 2.4. Also, the risk of tumor progression during the time of growth. ALPS has come up as an alternative, where we add the division of the liver together with the portal ligation, and the data so far indicate a faster growth rate of 7.4 and a growth maybe up to 75% during the first week. In that way, maybe more patients can be resected, and the treatment period might be shorter, the surgical treatment period, but there are no randomized study comparing the methods so far. Just a picture of what it can look like when you come back after ALPS doing the second step. So the hypothesis of the study is, may the growth rate of the ALPS method be a higher, and by that increase the resection rate, the rate reaching R0 without causing increased rate of Clavien-Dinder complications 4 and above. So we are including patients with colorectal liver metastases that after chemotherapy have an estimated future liver remnant of less than 30%. And this is just an example that it could be segment 2 and 3, but it can be other segments, and patients can have bilobal disease. They are randomized to either portal ligation, portal venous embolization, or to the ALPS procedure. All patients do a CT scan after 7 days, and the patients who have passed 30% FLR are going to second step resection. If they haven't, they do another scan after 1, 2, 3, or 4 weeks, depending on the growth rate. If they don't reach the estimated size, they may cross over from the portal venous ligation embolization group into the ALPS procedure after 8 weeks then. So what we present here are the preliminary data of liver growth rate, and so far 25 patients, but the main study is to look at 100 patients and looking at surgical success rate. We're also looking at overall survival after 1 year, cost-benefit analysis, patients' quality of life, and also metabolic studies, and hopefully microdialysis in a smaller group of patients. We have done power analysis for kinetic growth rate and found that we needed 40 patients. So these are the results with the baseline characteristics of the first 25 patients. We have no difference in these parameters when it comes to age, BMI, diabetes, primary tumor, if the primary tumor is resected, number of metastases, chemotherapy, and the standardized total liver volume, as you can see, is very similar, but the patients are a bit smaller in the ALPS group. But the EFLR is 22% in the ALPS group before the start of the study and 20% in the PV group. The distribution of metastases are about the same in both groups, but a bit more metastases in segment 2 in the ALPS group. And the results show that the FLR have grown more in the ALPS group after 7 days, reaching 573 milliliters compared to 432. The EFLR volume has gone from 22 to 37% in 1 week, and the PV group from 20 to 29. The ALPS is growing 37 milliliters per day compared to 14. And the volume increase in this study is 62% for the ALPS, but it's as much as 30% in the PV group after 7 days. The kinetic growth rate that you can see is 18 and 5. And all but one patient in the ALPS group had reached 30% volume after 7 days, but half of the patient in the PV group. So we conclude that the liver growth rate is, as expected, higher with ALPS than traditional portal occlusion. A higher rate of patients reach a liver volume accepted for resection in 7 days after primary intervention, But the growth rate after portal occlusion is, at least in this study, higher than previously reported, and half of the PVO patients reached the accepted resection volume after 1 week. And I thank all the cooperators from the different centers who have making this study possible. Thank you.